Hi everyone, my name is Tung Namen. I'm taking Bachelor of Biomedical Science and I'm the leader of Group 4. So today I want to share my reflection on our weekly activities and the class, which is the Ethic and Value in Interprofessional Education, PEC 301. Over the past few weeks, we have explored the four important topics, which is cultural values, custom of belief and social norms, patient's autonomy and medical consent, patient privacy and confidentiality, and patient safety and medical errors. So each of these topics are really helped me understand how cultural competence plays a very crucial role in healthcare. So first of all, I will show you guys a short video. So let's watch it. So now you have seen some highlights from our activities. I would like to share my thoughts on what we have learned. So we go to the first activity, which is the cultural values, custom beliefs, and social norms. So I realized how important it is to understand different backgrounds. The knowledge helps us provide better care by respecting patients' beliefs and practice. So the second, patient autonomy and medical consent, highlighted how crucial it is for patients to have the right to say in their healthcare decisions. It's about making sure they are informed and comfortable with their choices. So the third, when we talk about patient privacy and confidentiality, I learned that keeping patient information private is essential for building trust. Patients need to feel safe sharing their concern with us. So lastly, our focus on patient safety and medical errors taught me that clear communication among healthcare providers can significantly reduce the risk and improve patient outcomes. Next, I will do a little reflection on myself. Okay, so throughout these activities, so because we have conducted the topic 2, which is the patient's autonomy and medical consent. Okay, so reflecting on these activities has been a valuable experience for me. One major takeaway as a leader is the importance of sharing tasks fairly among group members. So we did task delegation, but on the event date, perhaps that's not evenly this delegation on tasks. Right? So this approach not only empowers everyone, but also enhance their overall learning. Right? So I have also come to appreciate how important it is to create an inclusive environment where everyone feels valued. Right? In my future practice, I plan to make sure that every team members has their responsibilities, and all these responsibilities are shared. This will help us work better together as a team. So in summary, this PEC taught me how essential cultural competence is in the healthcare. By understanding cultural values, respecting patient autonomy, ensuring privacy and prioritize safety, we can provide better care for our patients. Thank you for watching my reflecting video. I hope you all consider how you can apply these lessons in your own journeys as future healthcare professionals. Thank you. Bye.
Hi, my name is He Yi. I'm from BPH. Participating in activity focused on ethnicity and value in interprofessional education was an eye-opening experience that deepened my understanding of cultural competence and the importance of collaboration in healthcare. This activity emphasized how diverse cultural values shape professional behavior, communication style, and decision-making, which are critical in providing equitable and patient-centered care. In the first week, we involved role-playing scenarios that brought together the concept of ethnicity, value, and collaboration. Each scenario presents an ethical or cultural dilemma, such as navigating language barrier, following cultural practice, or addressing conflicting treatment preference. Working with peers from different professions, I saw firsthand how effective communication and teamwork could lead to better outcome. For instance, we resolved a case involving a patient refusal for a life-saving treatment due to cultural belief, balancing respect for the patient values with evidence-based care. The activity underscored the importance of cultural humility, the willingness to continuously learn from others, adapt to new situations, and value diverse viewpoints. By engaging with role-play scenario, I practice addressing ethical dilemma that require balancing cultural consideration with evidence-based practice. This scenario demonstrates how collaboration across profession can lead to more holistic solutions that respect both the patient and healthcare team values. For the second week, it's our group turn to conduct the activity. We conduct roleplay for some medical situation and quizzes related to the healthcare profession. Our activity centered on understanding ethnicity, cultural diversity, and their role in shaping individual and collective behavior. Through workshop and relative exercise, I explore how my profession, culture, background influence my value and execution. This session highlights the importance of self-awareness as the first step toward recognizing and addressing unconscious bias. I realized how stereotypes can affect communication with both colleagues and patients, emphasize the need for an open and respectful approach. Another impactful aspect was the role of value in interprofessional collaboration. The activity highlighted that each profession within a healthcare team, such as doctor, nurse, and pharmacist, bring unique value and perspective. Understanding and respecting these different foster mutual trust and enhance teamwork. For example, a case study we will involve resolving conflict that arose from differing professional priorities. Through guide reflection, I learned that clear communication and active listening are essential in aligning goals and ensuring the patient outcome remain the central focus. In the third week, we discussed how different professions such as medicine, nursing, pharmacy, and social work carry distinct value and ethical property. Through group discussion and case study, I learned how this value can sometimes conflict, particularly when addressing complex patient needs. One memorable exercise involved identifying overlaps and difference in professional values, which helped me understand the importance of interprofessional respect and how to balance diverse perspectives in team-based care. One of the key takeaways was the recognition of ethnic diversity and its influence on healthcare practice. During discussion, I became more aware of my own cultural biases and how they might consciously affect my interaction with patients or colleagues from different backgrounds. For instance, learning about varying cultural perceptions of health and illness underscored the need for sensitivity when discussing treatment plans or health education. For the last week, we played bingo and answered questions related to interprofessional. We reviewed our experience and discussed how to integrate this lesson in our future practice. I found the reflexive journaling exercise particularly impactful as it allowed me to consolidate my thought and identify areas for personal growth. One takeaway was the community of cultural humility, approaching every patient and colleagues with a willingness to learn and adapt to their unique needs. We also discussed strategy for creating an inclusive environment in healthcare, such as implementing cultural competence training and encourage open dialogue. Besides, this activity reinforced the importance of integrating ethnic awareness and shared value into interprofessional education. It reminded me that as a future healthcare profession, our ability to provide compassionate, inclusive, and effective care depends on our commitment to understanding and respecting the diverse cultural and professional background of those we serve and work alongside. In conclusion, this 4-week activity was transformative, helped me grow as both a future professional and a compassionate individual. It demonstrates that understanding ethnicity and value is not just about avoiding conflict or misunderstanding, but about fostering collaboration, empathy, and inclusivity. By actively engaging in this program, I feel better prepared to work in diverse terms and provide holistic care that respect both the cultural background and professional contribution for everyone involved. That's all for me. Thank you.
Hi, my name is Sivadurga Manukaran and I'm from MBBS Year 3, October 2024. And this is my reflection on the group activity exploring ethical issues. It was truly enriching experience that allowed me to engage with case scenarios that tested our understanding of ethics and values in practice. So for the group activity experience, most of the group activities centered on exploring ethical dilemmas through carefully crafted case scenarios. So, working as a team, we were tasked with identifying the ethical challenges, understanding the underlying values, and proposing potential solutions. One of the most impactful aspects of this activity was the diversity of perspective within the group. For instance, in one scenario involving patient confidentiality versus public safety, some team members prioritized individual rights while others leaned towards societal well being. This sparked thoughtful debates, and we had to find a middle ground by proposing solutions that respected both. What stood out for me was how the group dynamics taught us the importance of empathy and open mindedness. It became evident that ethical decision making isn't black and white. It often requires considering multiple viewpoints and balancing conflicting values. And besides that, one particular ethical issue that resonated with me was about informed consent. In the scenario, a patient with diminished cognitive abilities was refusing a life saving procedure. The dilemma lay in respecting their autonomy while ensuring their well being. So, as we analyzed this case, I realized how nuanced ethical principles like autonomy, beneficence, and non maleficence are in real world situations. So, initially, I learned toward prioritizing the patient's decision, but through decision, I saw the importance of involving their family, considering the patient's previous wishes, and consulting their ethics committees. So this scenario emphasized that ethical resolutions require not only clinical knowledge but also compassion and the ability to navigate complex interpersonal dynamics. Uh, Next, my feedback on reflection and project. So this project has been a valuable learning experience for me. Reflecting on ethical issues helped me understand how personal values and biases can influence decision making. So the structured approaches we use identifying the problem and analyzing it using ethical principles and also proposing resolutions was particularly effective and something I will carry forward into my practice in the future. And as for the group activity itself, I appreciated how it encouraged collaboration and critical thinking. However, I think future iterations could benefit from adding more time for discussion to dive deeper into each cases. Additionally, incorporating feedback from facilitators during or after the activity could enhance our understanding. So, in conclusion, this group activity has not only deepened my understanding of ethical principles, but also reinforced the importance of teamwork and communication in resolving ethical dilemmas. Reflecting on these issues has been eye opening, and I'm grateful for the opportunity to engage in such meaningful discussions. And thank you for watching my reflection. Yep, that's all.
Hi, so my name is Felicia. So this is my video for reflection on ethics and value IPE. So for the first week, we had been introduced to ethics and value. So like there's general introduction on the course outline and coursework component. And we will also be divided into groups for us to do the coursework for each week. And then there's also briefing on the projects that we will have to do. And lastly, there's also introduction on the concepts in medical ethics and value. So in week 2, we had been taught about cultural awareness and ethics. So by the end of this week, I had learned how to respect patients' cultural values, beliefs, and social norms. I need to be understanding of different perspectives to make ethical decisions in case scenarios. So for example, if a female patient from a conservative cultural background is admitted to the hospital, and if she requested for a female healthcare provider only, to attend to her due to her beliefs and customs, then what we're gonna do is we need to respect her request, and then we're gonna assign a female doctor or nurse on her case. So at the same time, we still need to explain to her any potential limitations or delays to attend to this preference. So for week 3, we had been taught about patient's autonomy and medical consent. So by the end of this week, I learned how important it is to respect patients' right to do their own choice, their own decisions about their body and their life, and how important it is to gain patient's consent. So let's say, for example, a minor patient came to the hospital, let's say 17-year-old male came to the hospital with a chronic illnesses that refuse a medical procedure. However, his parents insist on going ahead with it. So what we're gonna do with this is, despite the legal consent law for minors, we still need to discuss the situation with the patient to ensure that the patient's voice is heard, we understand the patient, and at the same time we need to explain the benefits and risks of the procedure in the way that they can understand. At the same time, we need to work with the parents to address their concerns and find a solution that respects both the patient's autonomy and the parents' legal role in decision making. So during the 4th week, we had been taught about patients' privacy and confidentiality. So by the end of this week, I had understood that we need to keep patients' details private, even if the person who is asking the details from us are the most important person in our life. For example, our mom asking for our brother's medical details, we cannot simply give her the details because it is unprofessional and non-ethical. And other than that, for example, we cannot simply talk about patients' details in public spaces, such as in the lift or in cafeteria. We cannot do that because it's unprofessional. So in week 5, we had learned about patient safety and medical errors. So by the end of this activity, I had learned about how important it is for us to understand how to identify and prevent risks that could possibly harm patients during healthcare delivery. Any harm that happens to the patient could also do a lot more trouble to us healthcare providers. So it is very important for us to do double, triple check or steps for us to prevent any risk that could harm the patients. So all in all, based from all the weeks that I've spent in Ethics and Value IPE, I think all of those things that I have gained will shape the person I am in the future when I will be working in the healthcare side. Okay. That's all. Thank you.
Ethical and values issue plays an important role in medical practice because it reflects the interplay between the cultural values, customs, and also the social norms. And these three elements plays an important role and shape the patient's and the medical provider relationship, and emphasize the importance of understanding individuals' diverse beliefs, their religions, and also their traditions, while also at the same time able to provide medical ethical care for everyone regardless of their beliefs and their traditions. And at the heart of this interaction, which is the patient autonomy, so every patient has the right to make informed decisions about their physical health or also mental health. So informed medical consent ensure that the patients understand completely what is going on and what the medical providers is going to do about their physical health, and this also allows them to actively participate and for their medical care and grounded with clear communications. And we as a medical provider have to respect their choices regardless of our beliefs and also our traditions. So another important ethical issues is privacy. So we have to protect patients' privacy and also confidentiality because it is our responsibility to safeguard sensitive information, which is essential for fostering trust between medical provider and also patient. And additionally, patient safety is our top priority, which is non-negotiable priority, as medical errors highlighting the need for continuous improvement and accountability in healthcare delivery.
is one of the major things that we should prioritize. And to better understand these challenges, so during the whole PEC, we will be engaged in different activities which is hosted by different groups, and each group will have a theme on its own, such as from our group is patients autonomy. So each group will analyze a real world scenario involving ethical dilemmas, which is, for example, conflicts and between cultural values and also medical consent, breaches of confidentiality, or response to medical errors. So by discussing these few key issues, we're able to propose possible solution and also reflects on how to ethical principle guide us to make our decisions, and so the importance of balancing the compassion, professionalism, and also accountability in every aspect of the care. And throughout these schemes and also our major project, I learned a lot about ethical issues in depth, which is not usually we learn during in our syllabus, such as learning. For me, it's my MBBS degree, so we didn't learn much about these ethical issues because we just learned about the fixed information. So through this PEC video, I learned that ethical issues plays a major role in our professionalism for future doctors. And also I also had fun participating in this activity because a lot of the groups managed to implement themes like such as patients privacy, confidential, patients autonomy into several different group activities for us to have fun ways to learn about these ethical issues.
Hi, so this is my reflection on the PEC, ethics and values. So in the first week, I was briefed about the concepts in medical ethics and values, and I was also briefed about the course outline and coursework component. We were also equally divided into group and assigned for each week. Each group was assigned to come up with activities so the other participant can join our activities, and each group was also given a theme. So based on the theme, we have to come up with activities. So for example, in week 2, the theme was on cultural values, custom of belief, and social norms. So at the end of the activity, I learned that following the cultural values, custom of belief, and social norms is very important, and also in relation to human or patient's right based on the case scenario is highly important to focus on, because in certain situation we have to understand and respect the patient's custom of belief and their social norms. So in week 3, the theme was patient's autonomy and medical consent, which was my group took up the activity. So we actually provided the activities that actually help the students to learn about the types of medical consent, criteria of legally valid consent, and there are special groups, like certain groups we have to really focus on, which is children, psychiatric patients, prisoners, and emergency cases. And there's also one activity that actually relies on the cultural and ethical consideration related to medical consent. On the week 4, the theme was patient's privacy and confidentiality. I learned that patient's privacy and confidentiality is very important, as there are certain cases that we cannot tell other people because it includes the patient's dignity as well. And moving on to the week 5, which is patient's safety and medical errors. The activities I participated helped me to understand what's the safety measures and certain protocols we have to follow on in order to make sure the patient is safe, and also the medical negligence that can bring bad impression and also unwanted situation to happen. On week 6, which is the last week of the PEC, I was assigned to do a major project with my group, overall group, and also do my reflection as well as do reflection for my both of the portfolio, which is one being the event I participated on, Songket Run, And also the second one where a scenario on how doctor explains us a patient on a surgery should be done, and how the doctor actually respects and gives some space for the patient to explain and tell her view or his view of point to the doctor. So that's all from me. Thank you.
Hello, my name is Tarvin Rao. My ID number is 012022100062 from MBBS Year 3 October. The following is my reflection based on my experience throughout the Ethics and Values IPE course. Starting off with the activities that we carried out during the course. So initially we were assigned a topic which is patient's autonomy and medical consent in IPE since the first day. So based on that topic, my group and I have decided to plan to conduct 3 activities, which include the first one, role play, quizzes and Kahoot. Before that, we plan to request everyone in the group to brainstorm an activity each that satisfies the topic. And then the person that suggested these activities also provided the instructions and rules for the game that they are proposed. In simple words, the first game that we we did was role play, which 4 scenarios are given, which the students are required to act out according to the scenarios. The group is subdivided into 2 beforehand. Therefore, one of the subgroups will be acting and the other group will be guessing the scenario. The scenarios are abided by the given topic to ensure the students are able to differentiate and comprehend a variety of types of medical consent. The second and third activity is about quizzes and Kahoot, where we provide questions along with explanations so the students are able to grasp and understand the importance of medical consent in the medical field. The main objective of these activities is to emphasize ethics and values by explaining the type of medical consent, the criteria of legally valid consent, cultural and ethical consideration in the medical consent. The participants had to utilize these criteria to complete the given tasks. From my observation, I believe we achieved our objective because I witnessed the participants sharing their thoughts and opinion throughout the activity. And also my role in this activity, I can see the participants communicating among the group members well to discuss and make decisions. I find that the activities conducted either by my group or other groups are very essential to understand ethics and values. And during the activities, I was constantly communicating with my group members and also enriching the bond meantime. I feel more comfortable and confident as I continue to communicate. Besides, during the course, I learned a lot about communication skills as well. I also learned how to ask and clear doubts by asking and communicating with my group members. I feel more confident and optimistic, which allowed me to be more proactive during the activities. And I also managed to understand the importance of ethics and values in medical field throughout this course. In the end, the activities we conducted were successful due to everyone's contribution, and I actively communicate with my members, attending the IP every day, participating in activities along with my members, and I feel I have contributed enough to the group, but I still could have did more. By providing more ideas for the major project or being a helping hand. Ethics and values are important for my future, specifically during my work and studies in the hospital. And ethics and values plays a key role in the medical field to ensure a smooth operation between the patient and also the colleagues and myself from different departments. A stressless environment can be achieved by grasping these ethics and values. As we know, in medical field, it could be very hectic, very stressful, very haywire, since it involves a life. The patients also could feel more comfortable and safe. Thank you.
Assalamualaikum and hello. My name is Wanafik bin Aidi. I'm from the BCT, Bachelor Cardiovascular Technology. This video I'll talk about reflections of my subject, Ethics and Values, which is my IPE PEC. So reflection on the first week, which is week 1, is introduction. The topic is Introduction to Ethics and Values. We learn what is ethics and what values in it. And next is a week 2. Topic is the cultural values, custom of belief, and social norms. So basically, the week 2 is a game that conducted by other group. So there are three games. The first game is acting or do role play based on the situation that have been given by the group that conducted the game. The second and third game they're playing at the same time. So the one game is a Kahoot, and the other games is a crossword puzzle. So basically we split into 2 groups. Week 3 is the topic is a patient's autonomy and medical consent. The week 3 is the game is conducted by our group. So they also got three games basically. The first game is also role play or acting based on the situation that been given by our groups. For the second game and third game, basically just a different platform, which is one platform is a Kahoot, another platform is a quizzes. Basically in that week there's a slightly problem on the, I think it's on the Kahoot, but we managed to conduct the games. And the week 3 is a patient's privacy and confidentiality, which is the topic that have been given. So the game is conducted by other groups, and there are also 3 games. So the first game is actually the situation that have been told by the faces, and they ask us on what's the solution and what kind of problem based on the situation that have been talked. And the second game is some kind of whispering games. Basically we line up in one group, and the person at the back or the front that been tell what were the sentence from the faces, and the back of it will tell the person at the front of it the tell based on the sentence that have been heard. That's the whisper games basically. And the third game is just the same as whisper games, but it's not about talk, but they acting. So we have to guess what of the sentence that have been told by the faces. All right. So next, week 5. Sorry, the week 5. The topic is patient safety and medical errors. So the game, there's 2 games. The first game is a bingo. In my opinion, the bingo is one of the longest game that I have ever been, because they debate on what words. Basically, the title in the bingo is what's on your mind about the patient's safety. About the patient safety, I guess. So we have to come up with one word about what is a patient about the patient safety, such as maybe a responsibility, professionalism, so on. So sometimes the words being debate whether the one group might not be agree of another group being that give a word. Next, the second game is we have been given a paper, and in the paper is questions, and the question is a situation, and there's like a MCQs questions. We have to choose what's the answer that suitable for the situation. So that's all from the week activities. So basically, what's the thing that I have get in the subject is, first I get the new friends. Next, I get to know how to communicate better and how to do a teamwork. So yeah, basically that's all from me. Thank you.
Hi, Assalamualaikum. My name is Ahmad Oz Imran bin Mohaiza. I'm taking Bachelor in Cardiovascular Technology, and this is my reflection video from Group 4. In Week 1, interprofessional education session focused on ethics and values through engaging activities. 2 key games were role-playing hospital scenario and a word association games. These activities highlighted the importance of empathy, communications, and professionalism in healthcare, and reinforced their collective responsibility to uphold these values. In Week 2, my group led an interprofessional education session incorporating 2 games to explore ethics and values. The first involved an acting and guessing games based on the hospital scenarios, encouraging creativity and critical thinking. The second was a Kahoot quiz focusing on ethical principles and values relevant to the hospital staff. The game was competitive and provided instant feedback, sparking meaningful discussion. Both activities highlighted the importance of collaboration, respect, and adaptability in fostering an ethical environment, making the learning process enjoyable and memorable. In Week 3, an interprofessional education session included 3 games that focus on healthcare, ethics, and principle. The first game assesses your observation, analytical, and communication abilities, focusing on attention to details. The second game was simulated a medical setting, fostering teamwork and ethical thinking. The last game assessed the correctness of a word or phrase, emphasizing the values of precise communication in a high-stakes situation. This game taught important lessons about the importance of ethics and values in the healthcare, emphasizing observation, honesty, ethical problem solving, cooperation, and a clear communication. They help participants get a better grasp of how ethical concepts work in the practice. For the last week activities, we are playing bingo games, a discussion on interpretation setting in the hospital, and the practical challenges to think critical and respond with appropriate behavior based on ethics and professionalism. The game was entertaining and participatory, allowing participants to practice ethical values while competing. The facilitated activities linked to ethical principles to the real-life scenario, emphasizing the values of integrity in the healthcare industry. And this is the example of the photo during the weekly activities. Thank you.